I really loved skiing. It's my thing. My father was an Olympic skier. We were learning to ski when we were young. He ran a ski lift company. And I've been very lucky to be exposed to good skiing in Austria, deep snow, challenging terrain. I have no problems. I'm Sam Patten from Melbourne, Australia. I'm an orthopaedic surgeon doing hips and knees now for over 25 years. Before that, I was an Olympic athlete. I was a 3-time Olympic competitor in rowing. My father was an Olympic skier, and I was used to elite sports. So for me, movement is life. And that's in fact the reason I took up orthopaedics, because I appreciated that movement's important for the human condition. I was getting out of a very low old sports car, I twisted my hip, and it just started to hurt. And I'm quite sure that that's when I shredded what was left of the labrum, and the symptoms really started. And I went from being stiff but functional in June of 2017 to being unable to walk more than 15 metres by November of the same year. So very rapid progression. I went into the hospital one day and I was limping, and the ward staff said, you're still limping, it's been 3 months now, get an x-ray. And so I went into a different colleague and I just said, what time do you finish consulting? Said, I'll be finished 5:30, Melbourne time. Nice, easy hours. So I just tossed the x-ray on the desk and he went, when do you want it? It was his only question. And he said, what do you want? I said, well, I've come to you because you do what I do. And you do what you think is right. You're the surgeon, I'm the patient, but I'm pretty confident that you'll do something that I would probably do for myself if I walked through my own practice door. And that's what happened. I was 54 then, and it's only been not even 7 years, but I can tell you, I just have no problems at all. I've returned to my skiing. My flexibility is better on my operated side than my non-operated side. And so it's been a very rewarding outcome for me, that's for sure. I'd say, in my opinion, in most patients, the AMIS approach is preferable because the ultimate outcome is often felt to be better. And so I looked into the approach extensively before I took it on as a surgeon. And of course, then I had confidence as a patient it would serve me well, and it has done so. Operation was done on a Friday morning, about 9:30. Took about an hour or so, a bit less maybe. And I went home Monday morning, only because he was away on Sunday. And I could completely have gone home on Sunday. So I was quite functional, I was comfortable. I stopped pain relief pretty early on, used very mild pain relief for 2.5 weeks. I had to remind myself to be patient because I was feeling good, thinking I'll do more, and thinking, no, there is no benefit in trying to do more. It's not a race. I know where I should be and I'm on this curve, everything is fine. Don't do more, just do it better. So I had to remind myself to do that, because there are times I'm thinking, I'll just go for a longer walk, or I'll walk a bit faster. But no, that's not going to help me. If I walk properly, if I take the time, if I move smoothly, I'll get what I want. And then, as in learning any activity, as I got to be doing it properly, I did it faster and better. So that was the challenge, was to remind myself that this is a learning curve. And I say to people, listen, you're not training for the Olympics, because I know. You're training to get walking properly, and it's a different thing. So when I hear a patient saying, I've been told I need to push myself, no pain, no gain, and so that's completely wrong. It's all about technique. If you're hurting, stop. Do it better, not harder. I've been able to achieve what my patients want, which is to forget they ever met me, the forgotten joint. In fact, I look at my x-rays, I can't believe I've got that in me. Because I know it's there, but there's nothing to say I ever had it except for the scar. Why did I have this operation for my problem? The answer was completely simple. If I was my own patient, that's what I'd do.